I'm Nicole.
I'm Allie.
And this is Acknowledge Knowledge.
And I'm Matthew.
Yes.
I'm here too.
Okay. You're supposed to wait for the...
Oh, so you were going to introduce me? Sorry.
I was going to introduce
Sorry,
you.
I'm on topic because I'm just being on topic.
Yes, this tracks for our episode today, which is about autism. But, okay, so this is an educational podcast where we use peer education to discuss a wide range of topics that we think the world should know more about. Okay, and this is Matthew. He is going to join us today for our topic of autism because he's a little bit more of an expert in the field. He works with a lot of people with autism, and he has a background in psychology.
Hi, I'm Matthew. I have a background in psychology. So I was working for at least 2 years in an ABA clinic, which is all about this focus of behavioral help and developmental disorders. So I used to work with a lot of kids, teenagers with autism spectrum disorder. So I'm really looking forward to getting into this. And as someone myself, I consider myself as sort of working on my own autism spectrum disorder every day. So I'm really excited about this episode.
Yes, and we're excited as well as the ADHDers in this group. So it's just going to be a really fun discussion, and we're going to get into it. And it's really nice, one, to have more than one person that has experience working with other people with autism, because, of course, you can learn about it, you can see how other people experience, you can know your own experiences, but, like, to really understand it, you need to understand that it affects individuals completely different and see that holistically.
You really need to see that full spectrum, that mild, that moderate, that severe, and understand that it's like there's so many different types of autism. There's so many people on the spectrum, and that's how a spectrum works. I love to say this, that a spectrum works is that everyone is on it somewhere.
Everyone with autism is on the spectrum somewhere. I don't think that it's not everybody has a tad bit of autism. That is definitely not true.
Well, no, I'm not saying that everyone has a tad bit of autism, but everybody has like ways that this part of their brain, or not even part of their brain, that this presents itself. I honestly think like if you think of it 0 to 100, then somebody could be completely in control of these symptoms or like understand like when they are like struggling with autism spectrum disorder. But let's get into it. I don't want to get in the way with what I'm...
No, because what I wanted to talk about was there is a lot of things on TikTok where a lot of people have been like misleading and saying things like, oh, well, everybody's got autism today. Like, no. And that really kind of takes away from people that are actually struggling and working every single day, and how exhausting it is to exist in this world when you have to wear a mask every day. So that, going into the spectrum, is a lot of people, before we get started, just like the picture so that you guys can have like an idea in your brains about how the spectrum really is. It's not like a line. It's not a linear thing, because autism has so many different components. So when it comes to social or sensory or something else, like you can need less support in social situations, but need a lot more support with sensory needs. So when it's a spectrum, it's like all of these are something that you might struggle with in a different way, but the spectrum is that some people have more severe sensory needs, some people have more severe, more in-depth support needs in social things and communication and whatnot.
And just to comment on that, there's really no way to overstate how interconnected our brains are and how complicated this whole sort of idea of understanding our own minds is. Because, like, don't think of a bar like I just presented it, like 0 to 100. That's actually the wrong way of thinking of it. Think of it as like a 3D, graph, like a web,
There's a quote actually that I just read in a book called Unmasked, where she says, if you know one autistic person, then you know one autistic person.
Yeah, you don't know them all.
That is such a simple but effective way to understand that like autism presents itself so differently in individuals due to just a number of different reasons, whether it's like gender or social constructs or your individual trauma growing up, that it's going to look so different in every single person.
And which will be really cool to when we get into this, are different presentations as well, and to have like a male as well, females as well, and just have those different experiences, because we all have different experiences, level of knowledge, and just different levels of our healing journey from the trauma that we've received growing up with autism without any kind of supports.
I love how you put it, as I'm a male, because no.
Do you identify?
No, yes, I do,
Sorry.
and I am a male, but I just love that. But should I get into?
Yeah, so we're going to start off by kind of talking about the diagnostic criteria, and then we'll get into like a little bit more of our own experiences and expertise, and then we'll end it with, again, our superpower versus disability discussion. Okay, so Matthew's going to go straight from the DSM-5, and we'll start our discussion here.
All right, so assuming that everybody knows what the DSM-5 is, it's diagnostic criteria of how these mental health disorders and illnesses are characterized, are given. A psychiatrist, a diagnosing clinician, someone would use this. So did you have something?
Yes.
Okay, go ahead.
Wait a minute.
Yes. You need to put your finger up. You know what?
Wait a second.
As my ASD presentation, put your finger up, because that helps me.
Yeah, honestly. It helps me because I don't know when to that's one of my biggest issues, and I never know when the right time to talk is.
And I never know the right time to shut up.
Yes. So one thing, what did you just say?
So I said the diagnostic criteria with the clinicians.
Mental illness and stuff like that. And one thing that I just had a conversation with, one of my best friends also works in psychology and social work and mental health, and we were talking about how ADHD and autism are, neurodevelopmental disorders?
Yes.
Which is a little different than mental health, in that for me, in the way that I think of this, and it might be completely different than most psychologists or anything like that, but for me, I don't think that ASD or ADHD, to some extent, are so much of an illness, or that it's really just
a way that your brain
So the
works.
way that your brain works, and the reason that it is so difficult to exist in this world with ADHD and autism is because the way the world was organized, the way that society currently works, is not made for more than one type of brain. It is made for a one track. Our education system is based off of factory workers. The way that we organize society is solely for a very specific brain type, and it doesn't include people with autism spectrum disorder. It doesn't include people with ADHD. And I think that the reason that it's hard and why we think it's disabling and why we're considered disabled is because it is disabling to fit into this specific puzzle. Right, I do not fit into this puzzle that you guys made, and is only made for one person. It's crazy that we don't have different pathways or make things acceptable for all different kinds of people. We just have this one idea of what a person is supposed to be normal, and that is not how the brain works for autism spectrum disorder or ADHD. And so, when it comes to mental health, it tends to bring a negative, disabling stigma, which in some cases it is very disabling, but in a lot of cases it is only disabling due to those
conditional disability.
Yeah, and which is why I love the superpower, which is why I love that we're going to get into that later on, because it's not saying that things in the past, they haven't worked. They could be working so much better if we understand how people can use their natural gifts and what is sometimes considered a disorder as a reorder, a strength, a superpower, something that is unbelievably powerful.
Reorder. That's
cool.
That.
Yeah.
Okay, so sorry. Getting into diagnostic criteria.
Let's get into it. And I'm going to go through it, and then we're going to talk about each one. So deficits in social emotional reciprocity, or being able to sort of reciprocate, ranging, for example, from abnormal social approach and failure of normal back and forth conversation.
That's where we go. Normal
back and forth conversation.
And what we stopped to discuss when we were just discussing this earlier, we were just reviewing it, was, one, the normal back and forth. I suck at normal back and forth conversation. If I try and have a conversation with somebody that's neurotypical and they're just like, oh, how was your day? Or how are you? And they just mean to say hi, you know? Sometimes, like, they don't mean what they're fucking saying and it doesn't make sense. And a lot of times, like, those conversations are really hard for me. But if I'm to have a conversation with Allie, who is also, brain works just like mine, and we will talk nonstop for 4 hours and discover everything there is to know in the world about each other. So, like, normal conversation...
Yeah.
Can we do it? No. But
can we
conversate? Yes.
Exactly. So there's going to be some implicit bias that is here in the book, just based on the fact that it's being diagnosed.
And it's not written by somebody with autism.
So going on with that thread, it's reduced sharing of interest, emotion, or affect, to a failure to initiate or respond to social interaction. So failure to respond to social interaction. Something that you'll see is that you're looking right at the person, you're like trying to communicate with them, they have like more moderate to severe autism spectrum disorder, and they are off a million miles away, they're in their own head, they're doing their own thing, they're either hyper-fixated on something, or they're the connection that like I am talking to you right now is not happening. So that's
considered, what they're talking about there some of the time? Okay, because like that would be like if I get hyperfixated and I don't hear anything. So, like, I don't, like, auditorily, like, I will not process any sound outside of what I'm doing if I'm hyperfixated. So, I didn't actually think of that as that being what they were talking about there, but that's makes sense with respond. And actually, this is something I've talked to about some of my parents, with some of my students that have, like, ADHD and or autism like presentations, is that if they don't seem to be responding, to start everything that you say with their name. Yeah. So that they know that you're talking to them. Because if they just think you're talking, they don't necessarily, even if they're the only person in the room, you could be talking to yourself, bitch, I don't know. Yeah. Right? Like, exactly. I don't know that you're talking to me. So if you acknowledge that I need to stop what I'm doing and, like, pay attention by saying their name, that can be really helpful. It is extremely helpful because it gives them a rule. It gives them a boundary. It gives them a structure to, like, how do these social interactions work? And we're going to get into it, I'm sure, later, that the structure, the boundary, the rules are super important with autism spectrum disorder. But going into the next one, deficits in nonverbal communicative behaviors. So this would be raising eyebrows, winks, like gestures, like, hey, what's up, you know? Hey, we're going to that place. I can't even do it. I can't wink at people. I hate winking. I hate nonverbal communication like that. It's not my thing. So, and this gets into, and I think it goes into... Used for social interaction, ranging, for example, from poorly integrated verbal and nonverbal communication. So poorly integrating that or bringing it all together to make a communication that, like, just flows. And this one really ties into the next one. So I'm going to let you read that, and then I'm going to put my comment. To abnormalities in eye contact and body language, or deficits in understanding and use of gestures, to a total lack of facial expression and nonverbal communication. And we were talking about this too. So, like, when your facial expression, if you're not, like, when you're around somebody that you're comfortable with, like, the facial expressions that you have as somebody with autism are completely different. Like, me and Allie were talking, and we were just like, when we have a conversation, our face looks like this. I'm not animated. I am just talking to you, and we're having a conversation. A normal person would think that we are bored and disinterested in what we're talking about, but clearly we're not. We love it. That, and then eye contact. So this is one that's really misleading
Mm-hmm.
because they think that we can't make eye contact. And it's not that we can't make eye contact, it's that it's not comfortable to make eye contact. And a lot of people with autism have trained themselves to make eye contact.
Mm-hmm.
And we also don't realize that that does not mean stare into somebody's soul.
Yeah.
So like when I make eye contact with somebody, I'm not just like looking in their direction. I am looking directly into their fucking eyes. And I didn't actually realize until recently that I'm not supposed to do that.
Mm-hmm.
Right.
It's a good thing to practice, honestly, because I think a lot of people in the world struggle with looking at someone in the eyes, but the thing with autism spectrum disorder is that uncomfortability.
It's so
that sort of,
uncomfortable.
that,
Yeah.
like, you'll see that social connection happening, and you'll sort of shy away from it, or, like, sort of, it'll be kind of like a tingling or a hurting in your brain. Not even like a hurting,
It's
but
just
like a
distracting
like
to them.
I can't look. It's like staring at the sun. That's one thing I've heard that is really good to characterize it.
Okay.
It's like staring at the sun. It's like it hurts my eye. I don't want to look.
If I'm looking at you, that's the only thing that I'm thinking about. Is focusing. Like I remember in college, I wanted my professors to think that like I know that I'm paying attention, that I care. I wanted to present myself in a way that like I was paying attention. But when I would sit there and I tried to maintain eye contact and I was looking at the professor and I was tracking them, all I was thinking about was the fact that I was tracking them and that I was paying attention to what they were doing. If I was just looking or staring down, or when you started talking and I start staring at this part of the rug over here, it's because I'm actually listening. If I'm like staring directly at you a lot of times, I am just thinking about the fact that I have to be staring at you.
I think it's interesting because also it's not speaking to, I think, the other side of it of like people that are higher masking
Yes.
and that have
That's what I
developed
meant.
and that have the ability to have that like superpower, I guess,
Yeah.
of like,
Masking.
for me, I have studied people's
Yes.
faces and reactions and things like of like, you're saying like you can't wink at people, and it's like I can wink at people really well.
I am
like,
very good at any kind of facial. That's the next thing. That's what I was going to get into. Let him read this and then start talking about that.
All right, so I'm reading the next thing. So, deficits in developing, maintaining, and understanding relationships, ranging, for example, from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or in making friends, to absence in interest in peers or people around you. Like lack of interest in the world around you, the social interactions around you, just being very focused on yourself, your internal world. This happens a lot with people with ASD.
So what I think is interesting there is like, because they speak about it being a deficit is in that same way of like, if you have studied it so intensely due to being undiagnosed and you mask so hard, it becomes this like on the other end of its strength where all of those things like I in like a people pleasing sense or whatever have like strengthened this social ability to on the scale of too much.
It's a common presentation of women too. So women with autism are like known to be chameleons. One, I'm unsure if it's based off of like emotional intelligence because we are forced to be more emotionally intelligent than men are. Like when we're brought up, right? Men are.
It's definitely more
given
expected
the
in society.
expectation to not have emotional intelligence and thus aren't forced to develop it. Women are expected to understand people's emotions, so we are forced to develop that understanding, and we are again more ridiculed and more. The way that we present ourselves in public is much more like regulated than it is with men. So when we grow up, I started in freaking kindergarten being told that I'm not sitting in the right way, I'm not talking in the right way, I'm not doing things in the right way. And so I had to modify what I was doing because I was always considered bad and I didn't want to be the bad. I didn't want to be bad. I wanted to be like, do things the right way. But at the same time, my brain is like, why? Why?
Yeah.
I'm listening to you. I'm being respectful. Let me sit how I want to sit.
I love that you say that why, because in my mind, that's a lot of what happens with autism spectrum disorder.
Yeah.
Instead of just like making that connection and saying like, okay, I'm going to empathize with you in this moment and I'm going to listen because I believe it's the right thing to do and I'm making that connection. I'm thinking, why? Like, why am I listening to you? I'm questioning what's going on and questioning learning from the teacher.
Yeah.
And it is definitely hard because in your own mind, you feel disconnected. You feel like you feel like you do have the right answer, you know?
Yeah.
And that is the real, that's something I've struggled with in my life too. Just like, okay, I need to throw out whatever's going on with me, my overthinking, this idea that like I have the right answer because I want to be coachable. I want to learn from this person.
Yeah.
So like logically coming to that decision. One more thing, I really want to say what you said, Allie, with like making it into your superpower or training it, because it's like realizing that you have that weakness, realizing you have that deficit, and sitting down with yourself and saying like, I'm going to figure this out, and I'm going to do it until I'm good at it.
Yeah.
Is that kind of like what you're saying?
Yeah, I think it was a very subconscious. Yeah, it was a very
Uh-huh.
subconscious effort where it was like a coping mechanism, similar how we were speaking about ADHD and how I thought, well, could I be in remission of like forgetting things? And it's like, no, I've just made adaptions. Like I always have like a cross strap bag so that I never forget it because it's always on my body.
Yeah.
I think similarly with autism, there are certain things that we do
in order to
emotionally that cope with certain situations, or behaviorally that we do that is super like ingrained to the point where we don't even know.
Like if you
why
have
we're
to
doing
start
it.
masking at 5 years old, I don't have memories from 5 years old.
Mm-hmm.
Right,
So
and the
I
age
don't
between
have memories of when I decided to start masking.
Yeah,
Mm-hmm.
and between the ages of literally birth and 7
Yes.
years old, there's so much in there that is ingrained in us that lasts with us for life.
Mm-hmm.
But I do have memories of the discomfort of feeling like I don't understand other people.
Oh,
So, like,
that's interesting.
When you just said that about the why, I'm wondering, like, if when we think of, like, support needs, if it's, okay, what's louder, fitting in or why? And I feel like when we talk about support needs, it just means that their why wins out over normal behavior.
I like that because it's like the social pressure is lost on them. The social connection is a little bit lost on them just based on how their brain works and how our brain works. And so instead of saying like, because I told you to, or because all the other kids are doing it, or because we want to be like a good group, it's like, okay, well, we're going to sit forward because if you're on like the side of the chair and then something happened, you could fall off,
Literally,
and all
all
these
people
things.
we want is to the reason, the understanding, the like. Tell me why. Like, don't ever tell me because I said so. I'm sorry, that means nothing to me. I don't fucking care why you said what you said. Like, bitch, please. But like, it's so. And what's interesting is that there's a correlation, especially with I have ADHD and autism. So since I've been medicating my ADHD, my autistic traits have been much more noticeable. I think probably because of the impulsivity and like I don't know. I don't know. I've heard like that happens with other people too. Or maybe it's just because my brain has like slowed down to the point where I can have logical thought instead of just spiraling insanity. But since that, I've been working on unmasking. Masking was a lot easier for me when I was not on ADHD meds and before like I recognized that I was forcing myself to do that. Once I recognized that that's a fucking mask, my why has been stronger since I've been trying to unmask. Because I've recognized, one, that it's exhausting to mask all the time.
That's a really good point.
And I am fucking sick of it. And I just, now that I am an adult with the cognitive abilities, the understanding of the world, and the understanding that there's other people like me that are fucking struggling, I think that it's important to not subscribe to what is normal, because that is the only way that we're going to make change and make it acceptable and normalize not having to stare somebody into their soul when we're having a conversation, because it's like, why is that what's important? What I'm saying is important. The fact that I'm looking at you is not.
And I want to speak on that a little bit because unmasking is so important because you're putting conscious effort and energy in your brain into putting that mask up, to maintaining it, to sort of normalizing your behavior based on how you've been taught. Instead of, one, either enjoying your life, letting it be more open and free, or, actually contributing to the conversation, contributing more to what you're actually doing, being able to focus on what you're doing, like you were saying, actually focus on the professor that's talking rather than focus on putting up that mask and presenting as normal and attentive.
I just had a realization of like why I went into the career that I did, because I work in marketing and I am remote, and my entire job as a writer, I don't have to be client facing really, and I do that really well, but to Nicole's point that it's extremely exhausting, and I developed an entire career that allowed me to work when I want, so not under that 9-to-5 construct. I don't have to speak to people, and I can use my creative ability in a way that allows me to think of things in my style, but also when I do have to interact with people, like messaging people through Slack or whatever, because ADHD and because autism, I am able to actually sit with the social interaction and respond at my pace versus like a live conversation, which takes more energy for me because I feel like I have to, I just have to use a lot more emotional and brain energy to have those interactions. So because I can sit and respond, it takes less energy for me to do that, and there's less pressure behind it. So I just realized why I naturally did that.
And I did the opposite and ended up with a severe chronic illness. And now I can't work. So, yes, burnout and chronic illness are common comorbidities with traumatized ADHD and autism, which if we get into an autoimmune disorder conversation one of these days, we'll talk about that too.
Right. Which is, I'm glad that you said that, because I think that is a massive difference between people that really are trying to stay fitting in and functional with society, but we have to see how that actually impacts people that are neurodivergent in general, but especially people who are autistic. It's that will manifest into ailments, whether it's physical, mental, because it can be
traumatic. I can do it very quickly too. The mental stuff, most people understand, and they've actually heard something about it. Yes, ADHD, autism, things like that have comorbidities with anxiety and depression because of all of that pressure in your brain to fit in. But a lot of people don't understand that it doesn't just trigger mental health issues. So when people have something like schizophrenia is also a mental health disorder. But with schizophrenia and with other things like genetic disorders, like autoimmune diseases that are genetic, you can have the genetic component for these disorders and never trigger it. So you can exist with the gene for schizophrenia and just never actually trigger schizophrenia, never have a schizophrenic episode, never present with any kind of symptoms of schizophrenia. You can have the genetic components for an autoimmune disease and never trigger it. But autism and ADHD, growing up undiagnosed and forcing yourself, or even diagnosed and not getting the correct supports, because we currently do not have adequate support in the world, just having to exist in the world in the society that we live in with a brain that doesn't fit into the norm, it causes that significant stress that triggers your autoimmune disorder, the gene. So I did in medical anthropology, we studied an epidemic of schizophrenia in Northern Ireland, which was due to, one, it's genetic. So they all had similar genetic components, so they had that genetic component. But in Northern Ireland, because of the extreme pressures that were put on men there to stay and to build, it's a big farming area, whatever. But basically the point is the stressors there were causing an epidemic in schizophrenia because every single person was in that same environment and it was triggering the genetic proponent.
That's interesting.
Yeah. So that has similar impacts. facts, and that's why there's like a connection between ADHD, autism, and autoimmune disorders.
Interesting.
Yeah, it definitely triggers that stress and lowers your immune system. Like, man, I'm going to be tense all the time. It's like basically tensing a muscle in your brain all the time if you're putting up that mask.
Which
so
tenses all the rest of your muscles.
Exactly. So learning how to let that go while not sort of hurting yourself and making yourself too vulnerable is really a skill, and really just the role of therapy.
Yeah.
Like seeing what is going on with you and what is going on around you that's affecting you.
Yeah. It can be hard sometimes with therapy and therapists and stuff like that, finding the right one with somebody with autism and certain levels of intelligence, and people that, because a lot of, unfortunately, and I'm not saying like all therapists, I'm not saying all people, like whatever, but in my experience, most of the therapists that expect to help you uncover why. Most therapists expect to help you uncover where this stems from and then teach you coping mechanisms. So if you already understand where everything stems from and you already have your coping mechanism built in, then they get kind of stumped on how to help you further. So I don't know if anybody else has experienced that, but that has been my experience with therapy. I had a therapist literally say, "So what do you want from me?" And I was like, I would like to have discussions so that I can know that I am not completely delusional and I am right.
Yeah, which
or not.
I think is interesting. I actually had a therapist recently say, she was like, I'm not the type of therapist that is going to, like, we're not going to like dig into your past and your childhood and figure out the roots of everything, because we can go down that rabbit hole forever, but it's not going to actually, she's like, I personally believe that it's not actually going to help you in your day-to-day right now. Like, things that we can do right now and we can help you with will be most effective if we're actually talking about the present. And so if you're dealing with X and we try Y, we can see if it works. And if it doesn't, that's okay. And I think that actually was helpful for me in that, like, I was over ruminating on my past. I was stuck in.
I was going to say, if you overdo it, yes, but at the same time, you have to understand. And the issue, I think, is when we don't let ourselves accept causation, right? So a lot of times, and love of my life, my husband will mention, like, okay, so what? Like, I should be over that by now. I'm like, no, because you're thinking about it like that, right? You need to understand where something stems from so that you can break it down and change your brain, the way your brain is thinking, right? So like but then you also need to know how to help yourself in the present, right? They're both so important, I think.
Right, yeah, no, they absolutely are. I think that there's a depth in psychotherapy that can be done, but then there's also like a different type of therapy that is really more addressing like behaviorally, like how you're interacting, mainly because like I think there is a lot of work in healing that like is about like always trying to fix something about you, which I think is important, that sometimes we realize there will be things that will be unfixable and maybe don't need to be fixed.
See, I don't like even that terminology. There's nothing that needs to be fixed. There's nothing broken about you. You're
and
not broken.
I think that is what helped me in that with that specific therapist, was that she was basically saying like, there is nothing about you that we need to like get to the root of so that we can fix it. It's just that you will have things in your life that will be difficult because of what you went through, and we can't always assume that we're actually going to be able to like get to the root of it and be able to heal something that's going to fix you now. It's like,
that's not what I think happens. I think it's an understanding of. So like, we are so off track.
It's okay. We can always edit it. Also.
Yeah. No, you guys are fine.
No. I'll say this one piece and then we'll get back to it. Okay. So I think, God, what the fuck was I saying?
You were talking about being fixable.
Oh, yeah. So it's not about healing that past thing. It's about understanding. So like one thing that's like probably easier for people to relate to and understand is like body dysmorphia. if I take my body dysmorphia, why do I have these body image issues, right? Well, it's important to know where it stems from,
Absolutely.
right? I grew up in the 2000s. The beauty was anorexia, right? That was the time of Paris Hilton and Lindsay Lohan, right? That was the front page, was them in this big of legs and whatever. And that was what we were aspiring to be, right? And that is why my brain looks at a normal sized body and thinks that I am an ogre because of like what that is what society like trained my brain to be what we are looking for. That in itself and knowing that is not going to change the body dysmorphia. I need to also learn how to cope with that in the present and understand one that my my worth is not derived by my physical appearance, and two, that there's no like perfect body to aspire to be. Like that's not the point of my existence. That's not the point of my body. It's not, and that can go again, and we can deconstruct that even more and understand like why do I think that my body is so important? Well, okay, well the patriarchy and male
and there's something I really want to say about you said that your brain was trained to think that way, and that's the thing that we all have to understand with acknowledging knowledge and with understanding what's going on with you. You have to know it, and then you have to retrain yourself. You have to practice. And that's what I really liked about what you said, Allie, that you and your therapist were practicing skills. We're putting things into place, trying something, seeing if it worked, seeing if it applied. And that's something that's really important in therapy. Like seeing what you're actually going to do, how you're actually going to change your behavior based on what you guys talk about. Because you can talk and talk and talk, and it's a really good catharsis and to get it all out there, and you might even come to a breakthrough. But if you don't change your behavior and your practice, it doesn't feel like you're doing anything. But also, to what Nicole is saying, in terms of discovering the reason, it kind of exposes it and lets you know that's why I feel this way, and that feeling is safe to have. When I feel like the body dysmorphia, when I feel when someone says something about a body or says something about my body, I'm not going to feel under attack. I'm not going to go into a fight or flight, anxious mode. And that is so much of the hard work of cognitive behavioral therapy, having these thoughts that are hard for you, and then sort of over time training yourself is like, it's not as hard for me. It was this hard, and now it's this hard, and now I can sort of, someone will say something that used to set me off all the way here, and I'll be like, just move along. I don't care about what you think. I know how I feel about that, and it isn't determined by how you feel.
Yeah, exactly. Okay, moving on. We got on track.
Yeah. And so I really wanted to say something that was, my brain was like calling out to me. It was like alarm bells were going off, and with how I process or how I work through information, I was like, are we going to get back? Are we going to get back? And I was like, no, relax, hear them, listen to them, have the conversation, understand them, be there in the moment, not be so focused on the parameters that were set, because those parameters are important, but they're not.
Is that
there's like a balance between them?
Is that something that you guys were?
It might have been trained from our childhood, but it also might be.
Because that's something that he does too. With things, he gets very upset when I seemingly don't
it's
follow
possible.
the right pathway, but my
See, here's the thing.
is...
Here's the thing. So it is very possible that it is something that was trained into us. It's possible that it's just how men, a big part of how men are trained to focus on the world. Like you focus on something, you get it done. You do this X, Y, Z, and then you move on. You know or it might be, genetic with he, me, and of course our wonderful. Our wonderful father sort of deal with the world.
It's because that's the way that your dad learned to cope in his own way, and thus put those parameters on you guys when you were growing up.
And even me, I'm working through my own like implicit need to sort of knee jerk and be like, okay, no, that's my dad. I love him. He's amazing.
Yeah.
And so working through that's how he was functional in his world, and he taught his sons how to function in the best way. So we need to, in his world. So taking the best of what he is, and then adding our own flavor, adding our own adjustments for society and our environment is what this is all about.
Yeah.
So in terms of this, my brain was like calling out to me. I was like, okay, when are we going to get back to the parameters? Because there were parameters, and I've got to hit those parameters, or else I'm not doing something wrong. Unless I'm doing something wrong, it's like, that's not how it works. It's a conversation.
So there's a pod conscious about that too. Yeah. And we do that a lot because we're like super obsessed with like time too because of the ADHD and like time blindness. So we're like, oh God, oh God, oh God. And that's internal in me too. Right. But I'm also not going to stop an important conversation because these important conversations are the whole point of this channel.
For autism,